Greetings! Today we're going to learn a little bit about ulnar collateral ligament injury, repair, and rehab. Everything you ever wanted to know. The ulnar collateral ligament, also known as the UCL, is the ligament that is composed of three different areas: the posterior bundle, the intermediate bundle, and the anterior bundle, located on the inside of the elbow, which is connected to the humerus and the ulna. You see, the UCL connects the humerus to the ulna in the arm. The UCL ligament provides stability for the elbow. It is most often injured in the throwing athlete, and especially in baseball pitchers, and especially now because pitchers nowadays are trying to throw faster and faster and more pitches. So this year, especially with the addition of the pitch clock, there are even more UCL injuries. Now, the UCL can be injured in other ways, maybe from trauma or other kinds of overuse. If that's the case, perhaps it can heal if you just allow it to rest. But with a baseball pitcher, that can't be the case. They have to perform. So for most athletes who injure their UCL, they have to have a surgical repair. Now, athletic trainers and physicians classify the degrees of injury to the UCL by different grades. The grade 1 sprain is when it's just stretched, not completely torn. The grade 2 sprain is a partial tear of that ligament in various degrees. In general, the grade 1 and 2 are usually treated with rest, not throwing, a rehabilitation program, but this takes a long time. In grade 3, the sprain is complete or full, and this 98.99% of the times is going to have to be surgically repaired for an actively throwing athlete. UCL reconstruction was first introduced by Dr. Frank Jobe. The goal of the surgery was to restore full function to the UCL. Tommy John was a player for the Los Angeles Dodgers, and he injured his UCL and became the first person to undergo ulnar collateral ligament reconstruction surgery. When the surgery turned out to be successful, voila, you now had the name Tommy John surgery. Since this surgery was initiated, they have used several different types of surgical procedures to do the repairs. You can read about those right over there. In general, there are various tendons that are used for the repair. The palmaris longus tendon, which is one that's in your forearm, right there, some people don't have it, is one that's used pretty often. And the gracilis tendon along the knee, which is kind of a little bonus tendon you have in your knee, those are good sources. Okay, if you get grossed out pretty easily, look away, because this is an actual surgical repair. The actual UCL repair surgery that we call Tommy John repair. If you look over at the diagram, you will see how the physician loops the tendon around the injured areas to secure it. After that surgical repair, that's where rehab comes in. There's going to be quite a while in rehab that you need to undergo before you can return to throwing. You have to allow time for your body to scar down on the repair attachment so that it forms a good secure attachment and can withstand the forces of throwing again. This all has to be done over time and very carefully. And if you're an athlete or you know one, you know that they're not very patient in getting back to playing after an injury. They want to get back in the game, but it's very important that the time is allowed for this surgical repair to really get strong and to get to be a functional elbow. Once again, 85% of the time they're successful. A lot of times that other percent is because you didn't do your rehab. So now you know everything there is to know about UCL, sprains, repairs, and rehab.